So, Bismillah, we are discussing about medical complication of drug administration and drug taking. As we have know that about research, you know about basically the drugs are applied. One is that therapeutic effect, and another one is side effect. So, first we
Mm,
discuss the medical complication when there is a adverse drug reaction when he has to be taken by someone. So, what the side effects are due to overdoses, due to allergy, due to idiosyncrasy. So you are aware, you have learned in your pharmacology that side effects, reactions are that are the undesirable effects of drugs that occurs when the drugs are given. So there are suppose adrenaline is desirable for bronchodilator, undesirable for palpitation. When it is adrenaline was given for bronchodilator, but when they give palpitation, that is its a side effects. Similarly, antibiotics desirable for antibacterial, but sometimes they produce GIF, so diarrhea they may cause. That is its a side effect. Similarly, overdose reaction is that reactions that results from toxic amounts of a drug. Example, vitamin A. So normal dose usually less than 5,000 international units. If you give more than 50,000 international units, are toxic amount. Similarly, many drugs can cause overdose reactions leading to emergency in dentistry, analgesics, antibiotics, anti-anxiety, local anesthetics. So they may produce side effects. Similar drug allergy had to happen when they apply the drugs. It is a hypersensitive response to an allergen to which the individual has been previously exposed to. So already exists antibodies. So what happens that there is a drug allergy also. So it has been clinically as what they produce, the fever, angioderma, swelling of hair, urticaria, dermatitis, blood elements, depressions, photosensitivity, anaphylaxis. So these are due to drug allergy. You can see in this picture how this patches has been found on the skin. Then many drugs can cause drug allergic reactions as penicillin, aspirin, latex, bisu, bisulfides. So what they produce? Allergic reactions are not related to the dose of the drug, but due to the immune system. So due to immune system, they can produce certain type of allergic reaction. The reactions may appear similar for the different drugs because they are caused by the same mechanism happens to that. Fourth one is idiosyncrasy, a unique hypersensitivity reactions that belongs to a particular drug in a specific individuals and cannot be explained as any kind, any known mechanism such as allergy or a overdose is different to that one. So clinically, a wide range of manifestation example is barbiturates or antihistamines. So excitation or agitation they may produce. The muscle relaxants they may produce hyperpyrexia. They may increase the temperature. So in continuation of this, we'll go to our second topic. So actually, that was when you take some drugs. So actually, uh, in a community pharmacy, you have to learn complication of drug taking. When drug, it's a drug abuse. When you abuse the drugs, when you take other than that drugs, the drugs for recreational for such purposes. So what happens to someone takes a drug? So it's a drug taking. So what effects when someone has to take these drugs? So there are four aspects of complication due to substance. So they're also known as substance abuse. What they do is development of dependence, behavioral problems, medical complications, social complications, and financial complications. So these are the when someone has to take substance abuse. Someone has takes to drug. These so what they produce? They produce dependence and behavior. Medical, including HIV, AIDS, cancer, liver, heart diseases. Social effects. Broken families, homelessness, crime, and violence can produce financial spending on drugs, healthcare. They there's a financial loss when someone has take substance abuse. So obsessive reoccurs. So someone is quite well when he's not is on drugs. So he's a interested in studies, work, family, children, girl, whatever, girlfriend, art, exercise, love, hobbies, love. Friends. He's a normal person. So when he remains on drugs dependence, obsession about what? Drugs, drugs, next dose, drugs. He remain on drugs, money, drugs, money. So the person who without drugs, he has a normal life. He has good in studies, he has a family, he has the children, whatever. But when the person is taking the drugs, so he has every time he has to take drugs, dose, then money, then next dose. So drug dependence, obsession about drugs. So everything, both you can compare obsessives when he is not on drugs. What he's thinking, what he think for when he's on drugs, he's taking the drugs, dependent drugs. So always he has to try for the drugs. So these are two things I have shown this cartoon over there. Then substance use progress from initial experimentations, often with gateway drugs, alcohol, tobacco, cannabis, gradually more frequent. So whatever in this the level of the level has have been increased. They need more doses. They more doses. So they are not satisfied. In suppose someone is on alcohol, someone who's tobacco, cannabis, or these are gateway drugs. These are the drugs which can enhance the dose because if first he was taking 10 milligram, next time he need more dose. So that's why it is known as gateway drugs. So the alcohol also. So what happens is dependence, harmfulness, use, regular. So when no use, experimental ions, social use. So gateway or alcohol smokes. So no use is quite well. Then what happened there? First experimentation, then social use, then regular use, then harmful use, then becomes dependent over the gateway drugs. So regular users start neglecting their life responsibilities and are unable to enjoy life apart from drugs. A tolerance to drug develops. There are withdrawal effects and dependence occur. So there is a tolerance level has been increased. They need more drugs when you remain on these gateway drugs. Then prolonged drug abuse changes the brain in ways that reinforce drug taking and lead to addiction. So when a person remain addicted to abused drugs, what they do, they change the brain in a way that reinforce drugs taking and lead to addiction. So changes are difficult to undo and last a long time. So when if someone has taken, so the brain has to say that whatever they has to need more drugs. So what they do, prolonged drug abuse change the brain in ways that reinforce drugs taking and lead. So they need more and more drugs. So change the tolerance level of the drugs. Drug and brain complications. So when short term, the brain complication, long term. The short term intoxication, confusion, delirium, blackouts, amnesia, overdose, then go to seizure. Long terms, they produce dependence, depression, suicidal behavior, psychosis, hallucinosis, sleep disorders, then sexual dysfunction. Further, they increase brain atrophy, dementia, amnestic syndromes, encephalopathy, cerebellar dystrophy. So these can be produced. So they short term and long term. The change in the brain, you can read over there that dependents have. So they need more and more doses when long term application of these drug abuse. The briefly outline most characteristics complications of commonly used substances, opiums, opiates, poppy, husk, whatever they used it. So they didn't use opium. afim, and poppy husk have typical effect of dry mouth, constipation, and meiosis, excessive constriction of the pupil of the eye. So they what they produce? Dry mouth, constipation, and meiosis. When ingested in large amount, it can cause respiratory depression and seizure. When overdosed, take more doses. What they produce? They produce respiratory depression and seizure of these opiums. Heroin. The real heroin among drugs of the abuse is extremely addictive. So it's a diacetyl morphine. So to learn develops rapidly and users shift from snorting to injecting intravenously to keep up with the requirement of dose escalation. So whatever mostly what earlier they have to snorting, they have to take by nostril. Then it then when the tolerance level has increased, they go towards you can you know that heroin is not available in parental form in injectable form. They prepare. You have seen these heroin addicted patients over the roads. What they take the powder, heat in aluminum foil, then they put in syringe and inject like this because there is no injectable form of heroin or acetyl morphine is available. What they prepare themselves in injectable form. They warm it over the aluminum foil, then it converted to liquid, then they put in the syringe and they inject. So what they produce? This thrombophlebites, DVT, infective endocarditis, pneumonia, pulmonary embolism, respiratory depression, abscesses, cellulitis. So these are the effects when someone is on heroin. Alcohol. Alcohol spares nobody organ. Common complications include alcoholic liver disease, cirrhosis, peptic ulcers, cardiomyopathy, osteoporosis, avascular necrosis. Now someone taking alcohol, then benzodiazepine. So when they are on benzodiazepines, so withdrawal seizure, memory problems, common cause of falls, fractures in elderly. Then also they cause respiratory depression when they are on overdoses. Nicotine. Someone had smoked or chewed nicotine. So leading cause of lungs, CA, CF, oropharynx, peripheral vascular disease, ischemic heart disease, GRD, peptic ulcer. They may caused by the nicotine. Cannabis is the most commonly used substance in the world, so it's responsible for various psychiatric disorders. Smoking, cannabis is linked to development of COPD also. So cannabis effects you can find over there. Cocaine, rarely available and used party drugs in metro cities over there. So they put hypertension, arrhythmia, paranoia, seizures, hallucinations. So overdose causes heart failure, stroke, respiratory failure, cerebral hemorrhage. Complications of substance use involve most specialties of medicine and rare leading cause of morbidity and mortality is that they may produce COPD, in that pulmonary embolism in lungs, bronch, 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 bronchitis, hepatitis, cirrhosis, CA, portal hypertension, pancreatitis, colitis, osteoporosis, vascular necrosis, peripheral vascular disease. So they cause peripheral neuropathy, similarly track marks, achin, cellulitis, botulism, tetanus, necrotizing fasciitis, thrombophlebitis, DVT, eczema, cirrhosis, myocarditis, arrhythmias, endocarditis, gastritis, CA, kidney stones, nephritis, sexual dysfunctions, infertility, miscarriage happen when the person takes these all types of abuse drugs. So they act over the various organ of the body and they produce such type of ailments, such type of disease over there. The most serious health consequences of addiction is the transmission of HIV. Now, due to this abuse drugs, there are the occurrence of the HIV disease. So, needle sharing, high risk behaviors, unprotected sex can cause these one HIV. So, on the UNODC's World Drug Report 2014, there are approximately 180,000 drugs-related deaths each year, most of them due to preventable overdoses. So this can be happens to more than 180,000 deaths has been reported due to these abuse drugs. So then the social complication of drugs of abuse. Now, what the person is on he has a family, then he is on drugs. So see, there's a disturbance in the family of a person who has taken taken a drug abusers over there. You can further say, I've told you that there is a social complication right from the addictions, obsessive preoccupation with drugs, neglecting his studies, work, family, and friends. So he's free from these things. So when he's on these drugs, he's always used to take drugs. He don't think of studies. Someone a student, so he's away from studies. Family has then they all exercises whatever happened as. So he has these things that he has not remain as a normal person. Social effects of the drug abuse: isolation, neglect of responsibilities, academic problems, disrupted families, EMAs, and legal problems are the other social issues than the person who remains on drug abuse. Addiction is a family disease. One person may use, but the whole family suffers. So this is the main thing that a person who used to take these drugs, he always, but his family suffers his this sin. Family sufferness. Almost every family has a person recklessly sharing needles, swallowing sometimes 100 pills a day, padding their blood, stealing, falling into debt, forcing their wives and mothers to give them their hard earned money. So there is a family problems when someone has on a drug abuse. Drugs and crime rate has increased. Drugs and crime are hand in gloves with each other. So if the crime rate has increased, the person who is taking drugs. So these crimes, drugs. So research shows that more individuals are held in jail for drug offenses than for any other offenses. Arrests, arrestees frequently test positive illicit drugs. Third, arrestees and incarcerated offenders were often under the influence of illicit drugs when committing their offenses. The cost of life, so drug abuse, financial effects. Substance use is a constant drain on the finance of a family. So buying drugs depletes resources, addicts poor health, lead to greater spending on health care, potential bread earnest for the family is lost. So the person there's a financial loss happens to the uh, families over there. This is further complicated by addicts' occupational problems. Occupational complications, missing from work, poor work quality, frequent workplace, accidents, poor rapport with co-workers, and eventually lose jobs. So burden to society also. Diversion of public funds for healthcare, wasted potential young workforce happen to when this social problem also arises. The drug trafficking affects the country in many ways. Drug abuse affects the health of the individuals and destroys the economic structure of the family and society. Drugs kill the pain and the joy and the hope and the body and the brain and finally the soul.